My name is Dr. John Pratico. I'm the Dean of the Behavioral and Mental Health Programs at Anna Maria College, which is located in central Massachusetts. I'm a licensed mental health counselor as well as a licensed clinical psychologist, and I've worked in a variety of clinical settings and academic settings across the Commonwealth. I have been impacted by suicide myself through the loss of family members and loved ones. So I know firsthand, like approximately half of the Americans, what it's like to have a family member die by suicide, feeling lost and confused and not knowing what to do, and also not knowing what the next steps could be and what one could have done differently. When it comes to losing a family member from suicide, often it can be quite sudden, even when there are a multitude of warning signs, even when family members know that they've had a loved one struggling for a long time. So there are two risk factors that I would want people to consider when it comes to suicidality. The first is depression. So feeling depressed is a large risk factor for suicide. And in fact, depression, one of the symptoms is suicidal thought. And the other risk factor I'd want people to consider for suicidality would be substance use. And those two things in combination are considered to be some of the largest risk factors. It's important that when you know somebody well, if you notice a change in a person's thoughts, feelings, or behaviors, in particular a sudden shift in thoughts, feelings, or behaviors, that's usually just a warning sign that's important to keep in mind. One of the largest myths of suicide is that if you ask somebody whether or not they're feeling suicidal, that in doing so you'll put that idea in their head. And that is a long-standing myth of suicide. Often it's something that acts as a barrier for people to directly ask questions to loved ones about it. It's quite critical for you to ask the question directly, whether or not somebody is feeling suicidal or not. So often you put it into the words that are most comfortable for you, but you do need to be quite direct. And in clinical practice, we often talk about the importance of open-ended questions, where you can ask questions in a way that provide lots of opportunities for a wide range of answers. And this is one of the rare exceptions where you want to ask a question that essentially is quite closed and allows for the person to say yes or no. So, are you feeling suicidal? Are you having thoughts of suicide? Yes or no. And that would be a really important follow-up. When it comes to the dual diagnosis or co-occurring disorders of mood and substance use disorder, it's important to recognize that any problematic substance use can be considered a benchmark for suicide. The ones that I would encourage clinicians and families to be particularly mindful of would be the disinhibiting substances. So alcohol, for example, is notoriously considered to be an acute risk factor for suicide, meaning that if somebody has some of the the undercurrent risk factors for suicidality, for example, feeling depressed and hopeless, and they're intoxicated on a disinhibiting substance. So any substance that increases impulsivity or is known to decrease one's ability to self-regulate your emotions and behaviors, those would be considered to be acute risk factors, meaning that while a person is intoxicated under that particular substance, or for example, drunk on alcohol, that does, in the short term, increase the risk for suicide. I think just across the board, I would like to see communities do a better job of supporting one another when it comes to mental health. What we've seen in the recent years is that the young adult population has been disproportionately impacted in terms of mental health as a result of the pandemic. We've seen first responders and first responder communities be disproportionately impacted as well. So in one regard, I would like to see communities do a better job of just having conversations around mental health in an attempt to destigmatize it in general. We commonly talk about the idea that When you have a family member disclose that they have a cancer diagnosis, we often will jump in and provide a lot of support for that person in their time of need. But if you had that same family member talk about feeling depressed or anxious, there's less of an automatic jump to support people when it comes to mental health. So that would be one way I would like to kind of see us continue to make advances. I'd also like to see an increase in mental health literacy. So there's wonderful programs out there. For example, Mental Health First Aid provides just a lay person's foundational knowledge about mental health and just common ways that we could talk to people about mental health in a way that's destigmatizing and non-judgmental. We've seen an increase in the use of telehealth services, which in some ways does decrease certain barriers in terms of access to care. And we've also seen an important spotlight being shown on mental health. So one of the outcomes from the pandemic is that we're seeing an increased focus on mental health and need for mental health services, and an increased need for the number and qualifications of mental health professionals across the United States.
To take this course and learn about others, click on the link in the description and subscribe to this channel.